This is Jerry Hesch. This is part 2. Client just stretched both sides, and she stretched less than 3 minutes per side. So now we get to put this back here, and let me align that with the blue mark. Okay. And this is lying differently. It was flat on the table previously, and I can run my pinky finger underneath that. Can you tell me, you just made a comment. Oops, okay, this is where it was before.
You got my arm in.
And we had your arm against your body. So, let me bring it up a little bit. It's lying differently. Okay, again, yeah, that seems elevated. Tell me how you feel.
I actually feel, where I feel it, I know I was pushing up here, where I actually feel something is behind. Like maybe because I'm lying on it, but in my shoulder blades.
Can you elaborate? I don't quite understand what you mean.
I don't know, because it feels like I feel something back here.
Okay.
That's all I feel.
Okay.
I couldn't tell you.
Most importantly, now this does not hit the table, this upper part. Previously it did.
Right.
Okay. I don't know that this is the best measuring tool. I don't know, how precise is it? There is a degree of subjectivity to this. What I can see is that it doesn't fit you. Okay, it doesn't fit you anymore. I'm going to change the shape of it now because I can fit my finger right in there. What I could do is draw an outline of the shape now before we change it. So that's probably a better way of doing it. So I want to draw from 0 to 15 centimeters. Okay, so let me take that off, please. And so I'm going to capture the outline. I'm going to go from 17 all the way. Okay. Got a little travel there. And okay, so what I'm going to do is now alter this to fit the contour. And I do see a distinct alteration in the contour. More importantly, because I think there's some error inherent in this technique, but the changed is right there. Okay, you can see the outline right here. It's kind of it's a bit of a shadow, but you can see that approaches 0, but it follows out here. Okay, but there's much more difference on the top there. Anyway, this might represent, this might be good data, it might be fair, it might be mediocre. The top one is the correction, is after the mobilization. But more important than that is how you feel. And it sounds like you're describing that you're weight bearing differently on your scapula. Is that fair?
Yes.
Okay. So this is the test that I want to do, and that is, can I take up the slack? And absolutely. There's a lot more freedom here available, and once I do take it up to a point where it stops moving, I can then induce additional mobility. Do you see that? Mm-hmm. So would you also stand up and give us some feedback? So I feel better about the, that test with that drawing. I feel like it is giving us some information. So just stand and give us some feedback. Earlier you tried to enhance your posture. Just go ahead and show me what you did.
I don't know.
That's okay. It's
I don't
okay.
think I can speak to it.
That's fine.
I think it's harder for me to articulate.
Yeah.
I feel a little looser.
Okay.
I don't feel as hunched, I guess. I don't feel like I'm stuck in a hunched position.
Okay.
I think I should do these exercises for a week and see how...
Right, I agree. And the purpose of this mobilization, it's very specific. It's in a very specific direction. It uses a fulcrum. It uses the high density foam that we sell. It matches the resistance. It matches what you put into it comfortably. So you're not leaning against a rock.
Right.
You're not leaning against a soft pillow. You're leaning against a type of foam that is similar to connective tissue in your body. It's more similar than it is different. Okay? If you just, lean against something hard on that one location, it wouldn't have worked. If it was really hard, you wouldn't have tolerated it. You wouldn't have been able to put enough pressure into it. If it was too soft, obviously it wouldn't have done anything. But this removes reflex inhibition in the scapular stabilizers. Now strengthening is going to be easy because now it has the mobility, the ability to go back where it belongs very easily. And so this is the point where we strengthen. The point is you first mobilize and gain that normative physiological motion and positioning. It turns on those muscles that have been overstretched in the back, and now retraining them and strengthening them is a lot easier.
Okay.
I might not articulate that well, but that's the basic concept.
Okay. No,
Okay.
I'll continue to do that exercise.
Yeah, and I'll show you some real specific
Okay.
strengthening for that interscapular area.
Okay.
I'll stop filming here. Thank you.